Welcome to our webinar, The Power of Co-Design in Research, Centering Parent Voices to Learn about Parent-Child Relationships. I imagine that most of you are familiar with early relational health, but to put early relational health simply, it is the state of emotional well-being that grows from positive connections between babies and their parents, caregivers, and surrounding community. Nurture Connection envisions a future where every family experiences the joy and benefits of strong, positive, and nurturing relationships. Our work is informed by a variety of voices and expertise, from parents and caregivers to doctors and doulas, to policymakers and researchers. Today's gathering is another example of how our work is informed by the voices of those who can tell us about their experience of early relational health. Nurture Connection's work is guided by a steering committee that brings together the expertise and leadership of early childhood leaders, researchers, policymakers, and critically, parent leaders. We're pleased to have representatives of the steering committee presenting today's webinar. I'm one of them. I'm Nikki Shearman. I'm Chief of Research and Innovation at Reach Out and Read. Another is Dr. Dani Dumitriu, a pediatrician, researcher, and associate professor of pediatrics at Columbia University, where she serves as inaugural director of the Center for Early Relational Health, as well as principal investigator of the Developmental Origins of Resilience, DOOR lab. So Dani and I are leading the academic and field research within Nurture Connection, and we're building the evidence base around the effective promotion and outcomes of early relational health. Stephen Thibert is also on the steering committee. He's a parent leader, along with two other parent leaders that ensure that parent voice shapes the work of Nurture Connection. And on today's webinar, we have two more parent leaders, Tiffany Solomon and Deepa Srinivasavaradan, are also part of a team of parent leaders who are part of our research team involved in the research design and implementation. And you can learn more about Nurture Connection at nurtureconnection.org, and be sure to sign up for our newsletter. Let's get going with today's conversation. Dani, tell us a little bit more about you. What led you to this work on early relational health?
I would love to, and thank you everybody for joining. I am going to start by giving you a little flavor of what we do in the lab and then how this came about. 1 second while I wrangle these slides. Okay. So in the lab, when we ask the basic question of what is early relational health, we study this from a variety of constructs. Some constructs are unidirectional, so bonding actually technically refers to the mother's emotional tie to the infant. Attachment similarly measures the unidirectional bond from child to the parent, or rather how they respond to the parent during stressful situations. There's also constructs that measure something unique about one member of the dyad or the pair, such as emotional availability or maternal sensitivity or maternal unpredictability. And there's also measures of child constructs that measure child, for example, temperament, that tell us something about that relationship. And then in my lab, we focus a lot on a dyadic construct, or rather something that measures an emergent property of the interaction between mom and baby that we call emotional connection. Now, for the most part, these constructs are studied separately in the lab, but for the first time, we have a study where we actually look at all of these constructs together. Now, it's a long study. It will take us a long time, but I'm going to give you a flavor of what this looks like when we just look at 3 of these constructs, bonding, maternal sensitivity, and emotional connection, in one set of about 400 mother-baby dyads. Now, I do say mother a lot. I do want to point out that this particular study focuses on mothers, but we do in the future want to include other caregivers, of course. Now, if all of these constructs measure something fundamental about early relational health and could be used interchangeably, then you would expect something like this, that there would be a correlation between one and the next construct. But when we put bonding and emotional connection into one correlation, we actually see this, which is a flat line representing absolutely no association between these 2 constructs. Similarly, maternal sensitivity and emotional connection also do not correlate, nor did bonding and maternal sensitivity. Now, this isn't just an intellectual exercise. When we looked in a small subset of about 100 mother-baby dyads at these 3 constructs at 4 months, bonding, sensitivity, and emotional connection, and how they predict something about child development at 2 years, we actually found something unique about each one of them. Bonding, for example, predicted lower chance of externalizing behaviors at 2 years, such as tantrums, for example. Sensitivity actually didn't predict anything in our cohort. Again, this is very preliminary. And emotional connection, broadly speaking, predicted overall more improved neurodevelopment. So things like cognitive function, fine and gross motor function, as well as language skills. But that's in the lab, right? And so, all of these studies have been done using constructs that we researchers have developed or thought of. So what this study was about was to ask the question of, are there other constructs that we can identify by just really listening to the lived experiences of parents? And so overall, the study was to go out to parents and ask them to describe their relationship and experiences of connection with their youngest child. Now, in terms of the methods, we began with an interview guide that we developed in the lab, but then there was a beautiful process of co-design that we're really going to dig into today with the parent leaders. That was over the period of about five meetings from July to September 2024, and each meeting was somewhere around an hour and a half to 2 hours. And we took those initial questions that we had in the lab, things like, tell me about your experiences with the pregnancy and birth of your child, and tell me about the first time you felt a connection, to sounding more like, tell me the story of your relationship, starting from whenever you felt it began. And that's just a sample question. And then the most unique part of this was that the interviews themselves were done by parent leaders without our intervening whatsoever in terms of the scientists, and they were also transcribed by the parent leaders. So there was complete anonymity between the parents who provided these interviews and researchers who then are able to study these. Now, before I turn it over for the parents to talk a little bit about their experience with this, I will just point out that we are very much at the beginning of analyzing this. So when I come back, I'm going to give you a flavor of what this looks like, but by no means the final product. So we have used methods that were used by folks on this call, including Nikki and Deepa, in a prior study looking at parents' perspectives on early relational health within the pediatric primary care sphere. And we use coders that read all the interviews, meet weekly, and look at emergent themes and develop a code book. And down the line, we will use these these interviews to really document these themes and see if we can come up with new constructs that we can use in research. And with that, I'll pause.
Thank you, Dani. Before we go to the parents, I'd like to ask you, what was your experience of working with parents? How did it affect how you did the research, and what did you learn, not necessarily from the parents, but about the process and how they were involved?
Well, I think the most fascinating thing is that it's a very different way of looking at questions. And what ends up happening is that there's innovation that simply does not come easily to researchers. You're sort of stuck in one mindset as a researcher, and when you have parents and researchers coming together, there's this fresh out of the box thinking that happens that is just so exciting. That was perhaps not surprising, but just really fun to experience.
Thank you. And then now I'm going to turn to our three parent leaders who were three of the parent leaders. We had several more than that who were involved in this work. And I want to ask you first, what was it about this project that encouraged you to participate? Deepa, do you want to start us off?
Sure. Thank you, Nikki. I'm really excited to be here. Thanks for this opportunity. One thing that really was sounded very interesting and appealing to me was the idea of co-design. I work with parent leaders and families all the time, and I have supported research projects in the past, other research projects in the past. Not all of those experiences have been around the idea of co-designing, and there have been instances where I had to just connect parents with researchers, and then I wouldn't know really how the researchers or research projects have engaged the parents. And then later on, I would learn from the parents about the process. But in New Jersey, I was invited to be a part of a research project, also related to Reach Out and Read. And then I was also we also had the opportunity to work with you, Nikki, on that. I started off with bringing parents to the table to form a parent advisory group, and then eventually became part of the entire research study process. And then I was also invited to co-author the paper that was published after the research was completed. So that entire process was really inviting, engaging, and it showed me that by valuing parent perspectives, and the co-design process can be very meaningful both for the researchers and for the parents. So that's why I participated in this project. As soon as I heard the term co-design, and with Nikki and with Nurture Connection in the picture, I knew it was all going to be super meaningful.
Thank you. Stephen, what about you?
Yeah, thanks, Nikki. So for me, being part of the FNC, the Family Network Collaborative, which is a cohort of parent leaders that connects into a community, speaks with at least 10 different voices from each community. We're a group of parent leaders from underserved or overlooked communities. Being a part of the FNC for the past 3+ years that we've been doing this work has just been an amazing privilege. And so for me, it was just an opportunity to be more deeply involved, learning about more about the research, with the whole process, and understanding how it's conducted. And again, just a privilege to be a part of that research and engage in the work. So that was really exciting for me.
Thank you. And Tiffany?
Sure, thank you so much for having us here. 6 years ago, I was asked to share my story and my family story personally. And I benefited from being invited to the table. I really was encouraged when I heard this was an opportunity to be able to speak to other real people, real families, real caregivers, and give them that similar experience of being able to participate, share their stories, and help to shape, the future of this program and future projects. Like my peers, I had previous co-design work experience. I was the first recruited parent of a parent advisory team, and became the leader of that group. And we currently are on our 4th year. Had some some previous research experience with that. And so I knew what it looked like, then I was just ready to jump in another time.
That's really great. I'm going to go to another question. What did you think about this as a project? What are you bringing to it? Let's go to you first, Stephen, on this one.
Yeah, so I think for me, you know, having been in this space for a while now and connecting into community, was able to really think through who I thought would best represent and give us a broad perspective from the research. It was a really innovative way to do research, and so you know, I was very curious to hear what I would learn from the fathers. I think the connections that I brought to this project were vast. I mean, there was a I interviewed 4 dads and all from different, socioeconomic backgrounds, as well as, so like there were a couple actually stay-at-home dads that were engaged in this project. And so, yeah, I thought that like that unique lens and connecting into community that I would be able to find some voices that would pair really well with the research and give us a broad spectrum of understanding.
And were the parents generally excited to be involved? Did you have difficulty getting people to speak up?
No, they were really excited to be involved and they wanted to like just understand it and also like be kind of kept in touch with the results and everything of that nature. But no, they were all willing and excited, especially I think the anonymity piece, because that I think, and I think we'll speak to it a bit later, but that allowed them to go really deep with their answers, and I think that allowed them to be even more open than they would have been if it wasn't done that way or with that process.
Yeah.
Actually, Nikki, can I jump in on that thought for a
Yeah, go
second?
ahead.
I would like to tell a little anecdote, which is that initially we wanted to have some involvement as the researchers in these interviews, or some more direct involvement. And it turned out that it was actually our IRB, or the Institutional Review Board, which, if some of you don't know, basically any research that you do with human subjects does have to go through a review to make sure it's safe for everybody, right? And it turned out that they just would not allow us to have the parent leaders sign the consent and keep the parents completely anonymous. And so, because we care so deeply about this work, we actually completely disconnected ourselves as Columbia University from the entire process down the line after the co-design, and handed it over to, amazingly, we have the partner of Reach Out and Read, to conduct these interviews as, and then be able to be involved back in the process. This created a completely anonymous process for the parents, and as you can hear, is so important to be able to generate such incredible data. So a little bit serendipity there too, in terms of how this came about.
Thanks, Deep. Thanks, Dani. And I'm going to go to Deepa with that question. Yeah.
Yeah, no, I was agreeing with both Stephen and Dani, and how this was such a disconnected process for you all as researchers, and how we as parent leaders were able to move the next step, move the parents through the next steps and gather information from them and bring it back. I really appreciated the parent-to-parent model that was embraced throughout the process. And I felt that this was also really helpful for the parents as they started to share. It felt more organic for them, because they could see that we as parent leaders were able to relate to the information that they were sharing. And I don't want to steer away from my actual question, Nikki. I know you wanted to ask me about what I was able to bring in addition to all of this to the project. Again, as I mentioned, I work at a family organization in our state, which is called the Parent Training and Information Center. There are over 100 parent training and information centers and community parent resource centers across the country and in the U.S. territories. And I'll share that information in the chat shortly after I finish my comments. So basically, all these parent centers are involved in supporting families, be equal partners at decision-making tables, and be co-designers and co-developers of programs, processes, and projects. So I was really excited again to be able to connect parents with researchers and research projects through this opportunity as well. And in addition to all of this, again, we have two amazing early relational health champions in New Jersey. I would be remiss if I don't mention their names, Dr. Manuel Jimenez and Dr. Osha Ramachandran. Both of them are amazing champions for this work in our state and have really been the people who connected me to reach out and read and all the research that's happening around early relational health. They also introduced me to the certification training, which is the modified version of the city training that researchers or anybody that's doing research with human subjects have to complete. This is a modified version of the city training, which takes much less time than the actual city training, but it obviously introduces us as community members to research related acronyms, information that we need to know and keep in mind as we work with human subjects. So that was a very helpful training for me, and it opened my eyes to be more supportive of the researchers and the research work that's happening. And then as the next step to that, I was also invited to participate in a community scientist program that was developed by Dr. Manuel Jimenez and his team at Rutgers University's Association for Clinical and Translational Science. And again, that provided an opportunity to participate in didactic sessions and discussions about how community members can support research. So again, it's really coming full circle, I would say, for me with all of these opportunities. And now I'm working with Dr. Manuel Jimenez to actually co-design and revise the community scientist program so it's more meaningful for community members to participate in that program and benefit out of it. So I know I took a longer time, but I hope that this was.
It is, because it's so lovely to hear that in some ways there is a career development process of bringing parent leaders into this research process to then become the bridge to the parents. And so there becomes a through line, as it were, to be able to hear that authentic parent voice that we've heard is so important and opens our eyes to so many things. And it's good to know that for you, and I know Tiffany might tell us a little bit about that as well, that there's a way of making this something that where you're trained and you know what you're doing and you feel you have an important role. Tiffany, do you want to add to that?
Oh my goodness, yes. First of all, I want to say that I am jealous and I wish I could go back in time and do the modified version of the trainings that are required to become to be put on an IRB. Deepa, I wish I had known about that before. Because I'm currently on 3 IRBs with Duke University and 1 with UNC Chapel Hill, and it was a grueling process, but also at the same time, I can definitely relate to what Deepa just mentioned about how this can become a career path. I mean, I had a whole different world of careers, 20 years in property management, 13 years in corporate America. And, you know, I quit my corporate America job to do this work full time after my lived experience and just, you know, seeing this opportunity within the space to as Deepa mentioned earlier, see organicness in the process and authenticity. Like my peers, you know, it's not my first time working within a co-design process or even in research on the on the research side, I was really excited to see changes in my community directly that I knew were informed by the data that I provided. From the co-design perspective, I understood the challenges, working with all different types of people in different walks of lives with real barriers. And also having, the experience of barriers within systems and institutions. So I was prepared for that here. I also, had my personal lived experience, and that perspective was welcomed, it was validated, and I felt valued as an equal contributor to this work. And so and that's what I bring to this project.
Yeah, we had such wonderful experience of all that everyone brought to this project. Tell us a little bit more about this particular project, what you thought of the co-design process. I'll take that to you first, Deepa.
The co-design process was certainly very meaningful, and when I had the opportunity to work with the parents and gather their thoughts and receive their feedback, I think what I was able to realize was that not only was it validating for me, it was also validating for the parents who shared the information. And in a sense, they felt it was therapeutic for them to be asked these questions that have been curated very thoughtfully, and of course with the input of the parent leaders. So they really appreciated the questions and the opportunity to be able to think, and even some of them were even happy to think about some things that happened to their child or their family in the past, and were able to appreciate the opportunity to share all of that, I should say. So it was therapeutic for them, and that was actually shared by one of the parents I invited to participate, and so I just wanted to share that.
Real privilege to be able to hear from these parents of their experiences. Yeah. Let's go to Tiffany. What about you, Tiffany?
Oh, well, so I definitely want to echo Deepa when she talked about this process kind of being therapeutic. I was thinking to myself just then, it was like therapeutic for me even. There was a lot of growth for me individually. First of all, because there's two different sides to the co-design process. The front end was us as parent leaders going through the questions that we would ask, and kind of being able to inform that direction. And then there's the co-design process where we're working directly with parents in our communities. So getting that different perspective from other parent leaders, and then being able to kind of look through each of those lenses of experience and understanding. For me personally, I know I was able to in some cases more clearly define the questions that I was asking in my interviews. In one of my interviews, a parent asked me a couple questions, asked me rather about a couple of my questions, like, what do you mean by that? And, I leaned on the insight that I got from our other parent leaders and was able to reframe my questioning for their better understanding. So, I'm taking that experience and moving it forward.
Thank you. And Stephen.
Yeah, I think generally echo what Deepa and Tiffany had said. I loved the process of the co-design, felt really confident that it was an open, safe space, as Tiffany mentioned, for different perspectives from parent leaders to help, shape the way we would go about conducting these interviews. I think we had everything that we needed. The process was clear, well set up. I think the interview questions, were the funnest part. I love getting into the interviews and hearing the stories that these parents had, and just to, again, I think we'll get deeper into it, but to echo what Deepa and Tiffany said, a very you could tell, very therapeutic process. I mean, I got answers that were a lot deeper than I anticipated, and it was really amazing. Like you mentioned, Nikki, just a privilege to be able to hold space for these parents to share things. I mean, I've known some of these parents for years, had the privilege of knowing them for years, and they're telling me things that I did not even know about their past. And you know, I feel like it allowed our relationship to become even closer. But yeah, so I mean, all of the process I think was amazing. I really looked forward to doing, once I got done with the first one, I was, you know, looking forward to doing the other interviews. I think it was an amazing, you know, really validating and uplifting process.
Thank you. Thank you. So we've talked about the process. Now, Dani, okay, tell us a little bit about what you learned. We're all waiting to
Absolutely.
hear.
I am dying to share some very early findings. So again, we just started analyzing this. Analyzing qualitative interviews is takes a long time, but it does turn out that even in this very early phase, we are seeing some early themes arising. The three that we've started to identify are: one, emotional connection is a feeling greater than words, or like an embodied experience. Two, differences between children in timing and quality of connection. So this idea perhaps out there that, you know, everybody loves each one of their children equally, maybe not in terms of the quality of their connection. And three, reciprocal joy and connection. And so for this early phase, what I've done today is just to bring a lot of these interviews in the words of the parents. So I'm just going to be reading quotes for the rest of my presentation, just to give you a flavor of the richness of these interviews. And just like Stephen said, the things that they were able to share in these interviews, again, because of that complete separation between the researcher and the parent, were really incredible and a real privilege for us to read. So for theme one, question: think of a recent moment that made you feel really close. Describe that moment. When I was in the hospital with her after her birth, I barely held her. I barely saw her. But when she finally came home and we just snuggled up in bed, it's just, I don't know how to explain it. It's just like there's a click there where there is almost, you could feel, I don't know how to explain it other than it's almost as if there's like a thread, you know, if you want to think of it as the threads between people, it's almost like ours just intertwined and just melded together, and it was just beautiful. Another for the same theme: how connected do you feel with your child right now? And again, we didn't say your child in the interviews. This is just because we anonymized everything, so there's no actual names within these quotes. There was a time when I was breastfeeding, I felt, I don't know what it's called, like something from my brain through my breast to him. Like I felt a lot. So I'm like, oh, we're definitely connected. I don't know what it's called, but yeah, there's a connection, a heavy connection. So you can see in both of these last ones, there's an embodied, like an almost like you can see that actual thread between individuals that these parents are describing. Another example: was it like instantly falling in love, or was it like the slow slide down this deep hole, you know, kind of connectedness? I will say that before she was born, I was scared. This is a silly scare. I was scared that I wouldn't have enough room in my heart for her. I was afraid that I loved my first daughter so much. How could I love anyone that much? Yeah, but when youngest daughter was born, it was just an instant. It was an instant, like the sun rising for the first time in the sky. It was just an instant pull of it, like gravity. It was like gravity. Now for theme two, differences between children. With your youngest, how connected do you feel to this child? Oh my God, I never felt so connected to any as I do to her, which is scary to say because I know I have two children, and don't tell my children I said that. I feel so connected with her, and part of me does wonder if that's because of the timeline of when I learned all these new things about being a parent and how to parent, because nobody teaches you how to do that. You're just thrown in it in the deep end, and it's like, all right, sink or swim, but you figure it out. Another example of theme 2. How is your relationship similar or different with your daughter? This one was hard when it came to her. So she's my firstborn, and I had this vision of what she would be. Reading came naturally to me, and I thought that time, reading or going to the library and things like that would create the same environment and that she would be a natural reader. When she struggled, I felt a level of disconnect, and I really had to step back, because as an educator, I was like, did I do something wrong? Did I not care enough? Did I not put enough attention to it? But she's just a different learner, and I figured out that quick enough, but I didn't. I felt disconnected when it came to that, whereas I kind of think that my son he's going to carry the same skill that I do, where reading comes easily to him. Finally, for theme 3, reciprocal joy and connection. Is there anything else you would like to tell me about your relationship with the twins? Like I said, I just get joy out of watching my babies grow. And the best part, even of working and coming in the door, is the joy that they have when they see me come in through the door. It's just an amazing feeling. That's the best I can say. It's like the joy I get from them is the same joy they get from me. It's just something, it's like I said, unexplainable. It's just a heartwarming feeling that you get when it comes to your kids. Another example of theme 3. Think about a recent moment that made you feel really close and describe it. Sure, after we drop his sister off to school, we passed by a construction site that has been present for at least 6 months, and he always comments on it, but we just keep driving. This week, I paused. They had something closer to the street. There were adults present, and we pulled over and we rolled the windows down and we sat there. We interacted with the construction worker employees. He talked about the digger and how similar it is to his digger at home. And I'm gonna be honest, I would never just stop and talk to strangers. But because he was there and his engagement, it gave me as an adult more power to get out of my comfort zone and to just say, I have a little guy who really loves construction sites and the tools that you all use. Do you mind us watching? One of the gentlemen even came over and stood in the middle of the road and flagged cars to go around us. Yeah, it was beautiful. It was just a moment, just the two of us. And I just love how this one also speaks to the other connections that grow from these connections. So with that, I will pause and bring back the parent leaders to talk a little bit more about their reactions to these beautiful quotes.
Yeah, thank you, Dani. And just before we go to the parents, I mean, I don't know if anybody else doesn't get a catch in their throat when you read those. It's so beautiful and so emotional. But how are you going to connect these responses? And I know you haven't got all of them yet, but how do they connect to your other research? What does this bring to your research?
So what we really are trying to do in our work is understand the entire sphere of early relational health. So, traditionally speaking, when people have talked about early relational health, they've sort of lumped all of these things together. But the reality is that the new science is discovering that each one of these things is a unique construct and predicts something unique about children. And as we're doing this work, we don't want to miss constructs. We want to make sure that if there is another construct that emerges from these interviews as we continue to dig deeper and deeper with the scientific lens, that we add that, like another kind of attachment or, another kind of connection, whatever it will be called. And if there is another one, we will absolutely workshop what we call it with the parent leaders to come up with a good naming for it. And so, if there is something new that emerges, we want to either create a new survey for it or create a new way of a new observational measure for it. We really don't know. We're just at the beginning of this of this work.
Thanks, Dani. Let's go to the parent leaders. I don't know if you've seen those quotes yet. I can't remember, but no. Tiffany, tell us how you felt when you saw them, and tell us a little bit about your experience of the kind of answers you were getting from your parents.
Well, I had to go off camera because I started bawling a little bit. I heard some of my parents' responses and bits of our conversations, and I had a personal relationship with each of those who were my participating parents, and so they shared information that was so intimate, and especially in relation to their upbringing, but also these really special moments of their bringing up their own children. And it was just a privilege that they would share some of those things, so confidential. Definitely helped me to understand even more about why they were who they are. But even in this space, just knowing, like I mentioned earlier, that their voices matter, that our voices matter, and when and how can it come through. So thank you for that, Dani. You got me.
Stephen, what about you?
Yeah, no, I mean, everything that Tiffany said, all amazing quotes. But yeah, I mean, it was bringing me back to the interviews, honestly, and the responses that I was getting. And even before Dani started, just those first three points I think really hit it home, especially like the like just hearing that, like the emotional connection being more than words. I remember those like any question around emotional connection in those interviews, the dads that I interviewed would really have a hard time describing it. Like they would pause and really think about it, and they would say things like, I don't really know how to describe it, I don't know how to put it into words. You could see like that the connection was there, but that they struggled to put it into words. And I think that really embodies early relational health, right? Like the connection you feel with your child is so deep. And then it made me laugh, but true, the not all kids kind of like not you don't, it's like such the PC answer, like, oh, and I only have one kid, right? But I always think like if I have another kid, because my kid is soon to be 5 and how close our connection is, I don't think, and we've been through so much, me as a single dad, I don't know that I could ever love another child the same. And so, and I've always felt like, the PC answer is always like, oh, I love all my kids the same. I've got a dad that has 3 sons, and he was like, man, I feel bad saying this, but like, his youngest, he's like, I feel like I like connect with him the most. He's the most like me. And so that's just so interesting, because I think that is like that seemed to be a recurring theme. But yeah, no, these are all like, this just shows the power of the work. And I love seeing those quotes. This is our first time seeing them, so it's like you can feel the power in every single one of those. So
Deepa, what about you?
My experience was different. I didn't know any of the parents that I interviewed so well. In fact, I was meeting all of them for the first time. So I had my own questions about how open and honest they would be about some of the information that they had to share with me. But I was really surprised to see that they made use of every single question, and they opened up and shared. It was again validating for me, and more so now after what Dani shared, because you know it definitely helps me understand that though parents from diverse backgrounds participated in these interviews and contributed their information, um, at the end of the day, all the parents are similar in that they want the best for their child. They want to be connected to their child, whether they know this term early relational health or not. They are doing what it takes to be a parent, and every moment they are trying to be a better parent. So that was really very reaffirming for me, and I really appreciated the process. Thank you.
Yeah, that's
If I
lovely.
if I can just chime in on the end, like Deepa was just mentioned, that was another thing. We got to the end and we're asking the parents, okay, well, out of all the things that I asked you, is there anything else that you wanted to share? And the majority of them were just, excited to be able to participate, and also excited about this opportunity to make a difference. And will I be able to see the information, the results, kind of. So that was a nice part. It's like that cherry on top, touch to the work that we did.
Mm-hmm.
And I would like to add that I think the co-design process and us explaining the co-design process to the parents help them feel more comfortable with sharing the information, maybe because they thought it was more anonymous than the traditional research projects or studies they may have participated in the past or they have heard about. So I think that also supported the process.
And there was a question that was sent in along with as people registered, asking about how you chose the parents that you were actually talking to, and how did you make sure that parents were incorporated that often were not included? One suggestion or example was a parent with a disability, and I think Tiffany, you had an example of that.
Yeah, this is my first time, outside of doing focus groups, this is my first time doing like this individual one-on-one interview for research. And in my parent advisory team work, I had this one parent who I was aware she had, a disability, visual impairment. And in our previous conversations, she'd mentioned, how appreciative she was, to be able to kind of give voice to it. We actually did a book screening for our pediatric clinic. And she was able to speak to the fact that, her visual impairment, and were the books that we considered choosing for the clinic for the Reach Out and Read initiative, were they taking into consideration things like, low impairment, black, white books, contrast books, touch and feel books, for all of the ages and stages. And so I actually recruited that mom specifically, and just kind of intentionally wanting to diversify the group of folks that, I had the opportunity to reach. And so, yeah, I think, there's the potential, being intentional about, kind of who you recruit, or the spaces, was important to consider.
Mm-hmm. And Deepa, I think when we were discussing that question, you were talking a little bit about the processes that you would use to make sure that we include a wide variety of parents.
Yeah, that's correct, Nikki. So in addition to all the discussions we had as the co-design team, I mentioned Dr. Usha Ramachandran being one of our early relational health champions in New Jersey, and she was part of this work as well. So, or the study as well. And then she and the parent leaders, I also had another parent leader from New Jersey participate on this project with us. So the three of us met and talked about the recruitment process and how we would go about it. And we came up with a plan to recruit parents from diverse backgrounds, a dad, maybe a grandparent, maybe someone from the South Asian culture, someone who is able to bring their perspectives of being a foster parent. So we had a wide list of items to consider as we try to recruit these parents, and that's how we went about it. When I did invite a dad to participate, he mentioned to me that he would absolutely love to participate, but if he also suggested that we meet with his wife separately to gather her feedback, because he said that he wanted us to have the perspective of both the mom and the dad. However, the mother did not find time to participate in an interview with us. But so our parents have also suggested additional ways of making sure that we're bringing diverse perspectives to this project.
Thank you. And then Stephen, you are our pipeline to the dads, which is always sometimes a group that gets left out, but they're in there. And I know Anthony Quinn is on this webinar, and I know he put something in the chat about, we got those dads there. Do you want to tell us a little bit about that? And then I wonder if you would also go on. You talked about being a part of the FNC, and there have been some questions apparently about the Family Network Collaborative, what that stands for. Would you like to describe it a little bit more, how it's set up and how we make sure that we've got a variety of parents in there and how that works?
Yeah, absolutely. I'll start with your first question. So I believe this was, correct me if I'm wrong, Dani, was it 0 to 3 or 0 to 5? Go ahead.
0 to 3 is generally what we focus on.
Okay. That's what I thought. So same with like all the FNC work, right? Like parents that have children 0 to 3 are the communities we connect into. And so that was my first criteria with the dads, is like, okay, where are my dads that are 0 to 3? Looked into my cohort, right? And then I tried to think through, again, diversity as far as like, where can I go diversity wise? Like, can I get dads of different races in here? Can I get dads of different socioeconomic status? So like, say there was a couple dads that are stay-at-home dads. One dad he has one child, one dad had 2, one dad had 3, and one dad had 7 kids, right? And one dad is a single dad as well, the one that has 7. And so that was where I was looking. Like, I really want to get a broad range of voices here. And I also thought about, in terms of my own criteria, having this I would say segue into this community and these connections is like, I think about, we go out in the FNC and we interview parents. We have questions for parents that help shape the nurture connection work. And I thought, who's going to give me like the richest answers if I do these interviews, right? And so I thought that through as well. And so that was important to me. But so that answers that. In terms of the FNC, so the FNC is the Family Network Collaborative, and Nikki, you can help me here if I miss anything. But we're 6 different parent leaders, right? Underserved or overlooked communities. So we have fathers, we have families identify as Black and Brown that have had home visiting services in Detroit. We have Native voice in New Mexico, Spanish-speaking immigrants in New York City, rural Alabama, so the South, and then children with disabilities, or parents of children with disabilities. And so what we do as parent leaders in the FNC, for 3 years now, we've been going into community and connecting with at least 10 voices from our given community, right? Our given voice, and getting answers to questions that have helped shape the work that we've driven forward in the Nurture Connection movement through the steering committee.
Thank you. And then so the diversity of the different groups, we have different parent leaders from different parts of the US. We have different races. We have fathers. We have a parent representing families with children with disabilities. So we try to cover the breadth. We can't cover everything. We've only got 6 parent leaders and 60 parents that we're reaching. But I think as we expand and grow, we will try to keep broadening the voices that we're learning from. Thank you. There was also a question that came back through the registration process. Dani, somebody was asking, they were saying, how does a basic researcher make sure that this promotion of early relational health gets out there and that learnings get out there?
I think the answer is we partner with organizations like Reach Out and Read and Nurture Connection. We as researchers are not the best to translate this work, but the partnership that we've had over the past few years has just been absolutely incredible, because I do see that our work meaningfully gets to end users, both in terms of the pediatric size, and getting this information out to pediatricians as well as out to communities through things like the FNC. So partnerships have just been game changing for me as a researcher who's used to be a lab rat.
Thank you. And then we kind of started moving on into the questions. Firstly, I just want to thank all of you for bringing your insights and your ideas to such an amazing conversation. And thank you all out there. You've all got your, the hearts and the thumbs up. We really appreciate your participation, and we have some great questions to raise. So this is a question for parent leaders. So are parent leaders already thinking of questions they'd like to ask next time? And then Dani, after that, a follow-up to you is, are you seeing something that you'd like to explore in another study? What's coming next? So Stephen, do you want to, are there any questions that you have that you think, well, this would be interesting to learn?
Not necessarily. I think for me, it would be about just going and doing it again with a set of parents, right? I think what was really nice and a privilege of doing the interviews was, there was the base set of questions, but then there were answers that I got that allowed me to dig deeper and ask further questions. And so I think that setup of the interview process really allowed for it to be this really organic process that led to going down different paths with different parents. And so I think that process was really enjoyable. But for me, it's just like, having the privilege to do it again would be awesome because, you're going to get different answers, but I'm sure would be a lot of through lines, right? So.
Yeah, yeah. What about you, Deepa?
I think I agree with Stephen. I think the more different ways we try to ask these questions, the more information we might get. And I think it's, I don't have ideas for specific questions in mind. I might have to look back into my notes as I was talking to some of the parent leaders to think about those questions. But I think I'm really motivated by this co-design process, and I'm looking forward to more opportunities to expand on this work that we have done together so far.
Yeah, yeah. Tiffany?
I will say absolutely yes, there were questions. So during the interview process, there were so many different ways that the conversation went, and I recognized that it was a black hole and we could keep going, but we wanted to keep it to an hour and a half, at most with our parents. And so, yeah, questions that were follow-ups to questions that we asked, questions that were, a continuation of the process for the later ages. And definitely questions that were like, okay, well, now we're talking about your childhood and what about in this other space with these other folks, I know Reach Out and Read is, kind of where one of our next projects is within the pediatric space. And so, just kind of that continuation on of how valuable these voices are and how we can intentionally use them in other spaces.
Thank you. And thank you. So Dani, how does this go on for you?
Well, a lot will depend on what we find ultimately after we finish really digging through. But I think one of the first thing that emerges for me is this very dyadic nature of what's coming up in a lot of these interviews. And for those of you who aren't researchers in the space of early relational health, it really turns out that most of the literature out there for something around 50 years has focused on individuals, right? Focus on the parent, focus on the child. And emotional connection has emerged, and by no means just my work, but more recently has been this idea of the dyadic nature and the space between and the flow of information between two individuals has really began to emerge. And what's really exciting is that even though these interviews were not written in such a way as to guide folks towards those ideas, there are some of these dyadic ideas that are coming through, which is really, really exciting. So, for me, I'm just looking forward to actually getting the final data set analyzed, and then I'm sure we will come up with many, many more questions that we can study together.
Thank you, Dani. I have another question directed to you, Dani. Have you seen interest from other researchers who are noticing the power of this model of collaboration between researchers and parents?
Yes, I will say that there has been actually in the research world a movement throughout the country in the last few years. So we are definitely not the only ones. We do think that we're doing things a little bit better than most, but there has been a movement, and even within the governmental funding, so funding from the National Institutes of Health, there have been explicit either calls for funding that is meant for this kind of work, or sort of similar work in which lived experiences are really taken into consideration. So as a researcher, I'm very happy to see that this is a growing movement out there.
That's just wonderful news, isn't it? And going on to sort of asking a little bit more about the value of this is to the parents. There's a question about speaking to the distrust that marginalized communities have with research and the history of extraction and exploitation. So how do you feel about that? And I guess how do you think that we overcome this by using this method of co-design here? To Tiffany, I'll come to you first.
Yeah, one of my parents, again, intentionally recruited, is undocumented. And so this was, a concern of hers was, kind of where is this information going to go? And I was surprised at how freely she shared some of her experience being undocumented within our conversation. But yeah, this was that the mistrust and obviously the climate that we're in currently is critically important to think about and be super sensitive around, just because we don't know the nature of where this information might grow to. So, I appreciated the anonymous and confidential space that we worked within. I think we probably would not have gotten all of the answers that we got.
Thanks. What about you, Deepa?
Yeah, I think we were definitely, as Tiffany mentioned, and also as we had talked before, I think the idea of the information being kept anonymous, I think helped the parents to open up and share. We had parents from diverse backgrounds. I know there's a lot of barriers related to culture that prevent some families from sharing freely. So what I was anticipating was some of that coming through as the interview progressed. But I think most of them, to the best extent possible, were not even thinking about not wanting to share. I think they just opened up, and you could see that they were really engaged in the process. They didn't even look at the time or anything when they were sharing information. We kept going, and then I had to remind them that we were actually at the end of the interview, and then some of them really appreciated the opportunity. And after we closed out the interview, obviously they wanted to hang around and talk a little bit more, learn about other resources in the community, learn about what else is happening with research, or what else is happening with this early relational health in their community, etc. So yeah, the conversations were very authentic and engaging.
Yeah. Anything to add, Stephen?
I think they covered it pretty well. I think for me, like the one thing I would mention, I think it really just comes back to the trust. I know that like our communities share freely because of the trust that has been built, and I think they trust that the information is, going to a safe space. And so and then I think like even in Deepa's case, that I would imagine, but I don't want to speak for her, but she interviewed parents that were new to her, but you know, there was a common connection there, right? Like obviously those parents, those voices trusted whoever was connecting them to Deepa. And so I think that's where really that trust building comes into place, and why I think that's been a foundation of anything that Nurture Connection has done.
Yeah, right. The other part of that question is for Dani. What are your plans for sharing the findings with the communities who contributed to this knowledge building?
So as with most of the work that we do, we are happy to share in as broad of a network as possible, including absolutely with the parents that contributed to it. Of course, the primary goal is to share with the scientific community, but we do have a very active website that we're building out in terms of also being able to translate our research into more manageable tidbits in terms of the main findings. And of course, hopefully we do another webinar once the final data set is analyzed, as broadly as possible. I will also share, if there are any other researchers on the call, that most of the data that we generate, we do make available as open science, as an open science initiative. So of course, completely de-identified, anonymized data, and we share with the scientific community to help us come up with more constructs and more ideas of how to study early relational health.
And of course, Deepa and Tiffany, Steve, and our other parent leaders who were involved, we will be making sure that they have all of this information that we've learned to be able to then pass it back to the parents that they spoke to, so that everybody feels that they've contributed and can see where it's going. Maybe some of your parents are on this webinar, I don't know. And then also, just to add, you know, as we've been doing more work with parents as co-designers in the research work, we're always thinking about how can we make sure that they know what they've done for their community, for themselves. What's the difference that they're pushing us towards, because we know how important that is and the value that they're giving. I have a question here. I might just ask somebody to raise their hand for this, or I can answer it if not. Many of us who are professionals are also parents. What then is the critical difference when room at the table is made for individuals whose roles are specified as parent? In other words, why is it important to have parents who bring their first identity as parents to the research co-design, in addition to having researchers and clinicians who are also parents? Does anybody want to speak up to that?
I can take a stab at this, because we actually, with my my grant initiative, we had this instant show. It popped up at the very beginning, because we intentionally recruited, you know, people with lived experience, and then we had folks who were from the community, and then we had folks who were from the clinic, you know, kind of staff. And then we had this governance body who was a part of our funding group, who was like, okay, all right, so I keep hearing you say comments about being a parent, but you're coming from the clinic space, stay in your lane. And so I think there's you know, probably going to be two, you know, kind of thoughts of thinking. In most cases, I show up as a parent in this community work, but this has translated to a career for me too. And I currently lead a nonprofit. And I do have to kind of tread a thin line and separate that space when I am coordinating my parent leader, you know, responsibilities. I stay in a parent, you know, leadership role, but we're training them to be leaders. And so I also kind of give them that, you know, some of that information, and kind of feed that through, so that they understand the difference when they're walking into these other research spaces, or these institutional decision-making spaces, so that they have the ability to do the same on both sides. So I would say that's a hard question to answer, though.
Yes, right. I also think that, and this is something that Dani and I have been trying to do. We've been enrolling families to a longitudinal cohort, where we're learning from families actually through the assessments and so on. It's trying to make sure that we reach all the families. So if you're a researcher, chances are you're pretty highly educated, and you've been, you've got that experience of life. Is very different from having somebody who is not highly educated, or who has come to this country as an immigrant and maybe doesn't have a high income. It's also different to somebody who does have a disability, or children with disabilities. And what we're trying to do is make sure that we hear about the lived experience of everyone rather than just a few. And so this particular piece is making sure that we learn from those who we don't often learn from. And the researchers at the table, of course, can give their input. They're giving their input anyway. So through those pieces, I think we learn a broader spectrum of experiences than just relying on those who are already at the table. And just to point out, it's through this process, it's critical, we think it's critical that we pay the parent leaders and the parents for their time, because they're giving time to us in the same way that a researcher or a scientist or a clinician would do. It's important that we do those things and respect their time and what they're giving to us. Anything else to add to what I've said? Otherwise, we've got some more questions. We're getting some great questions here. This might be a little more difficult to answer, but how did you deal, parent leaders, with responses that were hard to hear? Stephen, do you want to kick us off on that one?
Sure, yeah, that's a great question. I think, man, just holding space, not trying to just listen, try not to speak, empathize, with how hard that is to share. And yeah, I think that to me really sums it up. I mean, there were definitely some answers that were hard. I mean, someone who had been a friend of mine for quite some time, sharing some, and actually really close with his brother as well, shared some like very traumatizing things from their childhood, and I was just like, whoa, and then like I needed to then go like decompress after that, like, oh my gosh, that was like really emotionally heavy to hear. But I think just like holding space, and I think like personally that allowed our relationship to go to an even further deeper level, which is kind of cool, all in all, despite that happened to them. So yeah, that's how I would answer that.
And I agree with Stephen. I think many of them, as I mentioned previously, appreciated the opportunity to share, even though some responses were really difficult for them to share. They appreciated the opportunity to do so and kind of unpack some of what they have been holding on to. So, and again, obviously holding that space and offering a listening ear and lending your calm is not easy. So it did definitely take a toll on me as well. And after the interviews, I had to really take some time to decompress as well, and really take the time to connect with the parent as a follow-up to say a thank you for what they did, but also to connect them with some resources that I was aware of that could possibly help them, or help them find some connection to someone that can provide that for them. So.
Agreed. Like my peer said, definitely we paused and took the moment. We cried together in my interviews. You guys, I will cry in any situation, including a presentation. We laughed, profusely in a few moments. So it wasn't, some of them were just like, your nervous laugh, my nervous laugh, both of our nervous laughs. Now we can't stop laughing because this was so crazy. There was also, in my instance, and Deepa kind of intimated, like to this, I had some personal moments where I heard my story conveyed, my childhood conveyed by two of my, interviewees, and knowing how to take a moment for yourself there. In one case, I related to that person and just said, I'm having a moment with you here. And the other one, I had to take that out of the interview process and decompress afterwards myself about it, like, woo, and so I think that was important to note. And also with two situations, I actually, after my interview ended and the recording stopped, I checked in with those parents and said, hey, I would like to take this outside of our space because I may have a resource or two that might be a direct benefit to you. And in both cases, they allowed for that. So it did give me the opportunity to take it outside of space and actually not intervene, but add to some support that they needed in the moment. And so that's how we handled those difficult situations.
Yeah, thank you. And there's a similar question here of asking about, did any of the parents express difficulty with their own parenting? Was that a theme that came out as well, that you've obviously, we've heard about their own trauma, but sort of I don't feel like I'm being a good parent, or I can't connect with my child. I'm seeing nods. You heard those messages as well, which are also equally hard. Were there any stay-at-home mums interviewed? We've heard about the stay-at-home dads. Were there some stay-at-home moms as well?
Yes, I had one mom who was a full-time stay-at-home mom, and she was a nurse. And when she had her first child, and then that carried forward to a second child. I don't want to do career stuff anymore. I want to be with my children. And then one of the other parents was the exact opposite. She stayed at home with her first child, and went to work with her second child. So I got that perspective on two different ends.
Okay. Anything else to add there? I have a question for Dani. Just a second. I just jumped in find the questions again.
I can just piggyback on the last question.
Yes,
because we did not explicitly collect demographics with this work. We did, as a group, with the between the researchers and parent leaders, decided to just have that sort of an open question of, like, what do you identify as, like, whatever that might be. And we specifically did not really want to gather demographics, not just from the anonymization perspective, but also because this work is not yet the piece of what works from whom under what conditions. That's what we want to do in our larger effort of doing the longitudinal study that Nikki mentioned earlier. That's where, if we do identify a new construct, we will put it into that longitudinal study and get thousands of data points to see, if that construct resonates with various communities. But at this point, we just wanted to listen as broadly as possible and not really worry about the demographics, with the exception of wanting to have a very diverse group.
In fact, that was one of the last questions, kind of in our in the forum of the structure of the interview format. It was one of the very last questions. So.
And then, related to what you've just said, Dani, there is a question about, did you collect any data measuring the amount of parent-child time together? But that really wasn't the focus of this, but you are doing it in the combo, right?
And there was a question about sort of how much time they spent together, as well as their childcare arrangement. So there was a little bit of focus. Just so you know, the interview itself had multiple sections. So it also had a whole section on their own childhood to really start connecting the dots between their childhood and their parenting. It had also a section on their relationships in general, sort of their adult relationships, to understand what the relationship is between your relationship with your children versus your relationships in general. So it was a very in-depth interview. That hopefully we will have many, not just one output from. Right now, we're focusing on just this piece of, like, their relationship and how they describe it with their child, but there will be additional pieces to look at.
So folks, look out for more webinars. There's more to come here. There is a question that I can answer quite quickly. I think it says, how did you ensure language accessibility to allow for more family engagement? In this particular case, we asked parents to go out to their own group. And so, you know, if there are parent leaders that we're working with, and we do have parent leaders who are Spanish speaking, they will be speaking to their Spanish speaking families. And we try to keep, as I said earlier, broadening the diversity of our parent leader group so we can keep expanding. But clearly, obviously, when you're if Tiffany's having a chat with her families, and the language that they're using is the language that we're all using. That's the way it is at the moment, but we are getting better at including more languages. Now then, I have got some questions coming in that I haven't quite read, but they're about public policy and public health. And so this is for Dani. I'm wondering how we can sustain and expand this work by connecting it with similar organizations' practices and public health policy. As a parent leader, HHS lived expert, and recent MPA graduate with training in IRB research, I think there must be a shift from the traditional state and federally government funded research efforts to grassroots and global initiatives. Can you take a crack at that one, Dani?
Actually, I think it's more of a nurture connection, and I wish David Willis could come and answer that question, because again, it is not in my wheelhouse. You know, the one piece that I can answer is that, again, the exciting part about this work is the collaborative nature, and the fact that we really have those kinds of folks at the table, you know, along the way. So Nurture Connection has been really the engine behind that piece, that policy piece that I know nothing about, so really can't speak about you know, the details of it, but I can speak of the importance and the privilege it's been to be a researcher who is now connected with that sector through Nurture Connection. And I don't know, maybe Nikki, you can add a little bit.
I think that's what I would have said. It's we all have our little piece to play. And the beauty of this work that we're doing is that we're all working together. We're all collaborating. We have parents giving input. We have scientists. We have clinicians. Everybody is doing their piece. And then also within Nurture Connection, I think you all know, we're kind of making sure that the community has their voice, and making sure that we are connecting this to public policy. So take a look at the Nurture Connection website and dig in there. We're trying to do these things. And I think we're nearing the end of our webinar. I want to once again thank Dani, thank Deepa, Tiffany, and Stephen for really enlightening us and bringing such a wonderful story to this webinar. It never fails to amaze me how working with parents, and I've been doing it now for several years, just opens my eyes to a new way of looking at things. And usually it's a very beautiful way. And it's usually something that really enriches how we see things and how we do things, that makes it, I wouldn't stop doing it for the world. It's just amazing. So I want to thank you. And there's plenty more of this to come. So I just want to say thank you again. And then I'm going to hand over to Dani to close us out with a come to the next webinar. Dani, over to you.
Sure. So this is a really, really busy week. Tomorrow, Nurture Connection is hosting another seminar that will focus on the recent NASEM Early Relational Health consensus report. It's really been such a privilege. I did get the exciting opportunity to serve on that consensus report, and you can learn much more about what it's about tomorrow, as well as actually you can read it. It is available online. I don't believe we have a slide, but just for like 10 seconds, I want to put in a plug that if anybody's also interested in learning more about the Center for Early Relational Health, please contact us. And we do have an open roundtable science discussion about the whole center and all of our initiatives this Thursday at 4 p.m. Eastern Time. Thank you so much, everybody.
Yeah, thank you. Goodbye.